Have you been injured, had an MRI, or feel like you need an MRI? Have you had an MRI, been told that everything looks normal, and yet you still hurt? You're not alone. Let's discuss the role of MRIs as it relates to neck and back pain and recovery in this two-part series. Hi, I'm Dr. Matthew Collins. I'm a chiropractor. I am board certified in rehabilitation, and I'm fellowship trained in primary spine care. In addition to my training, education, and experience, I have been using MRIs for decades with my patients with neck and back pain to arrive at a more accurate diagnosis and to change treatment plans and give them better results. Now, please note, these videos are not a substitute for professional medical or chiropractic advice. They're not a substitute for an accurate diagnosis, nor are they a substitute for appropriate medical or chiropractic treatment. These videos are strictly for informational and educational purposes only. Seeing the wrong doctor can result in an incomplete diagnosis, the wrong treatment, and persistent pain with poor recovery, or regrettably sometimes no recovery. In the last video, I discussed the needs of the patient. Why would a patient need an MRI? Go back and watch that video if you didn't see it. Now, we learned from that one that doctors need to read their own MRIs. Chiropractors who order MRIs, however, oftentimes still only rely on the reports. There's a problem with that, and we discussed that in the past. So go back and take a look at that one if you have any questions. Now, here in part two, we're going to use a real-life example of how an accurate diagnosis led to better patient results. In 2024, I completed a spine MRI mini fellowship in neuroradiology. Part of my mini fellowship required that I publish a case study. My case study was of a patient who had a missed disc injury on MRI. The case study was published in the National Institute of Health Library of Medicine. Here is the patient's story for you. Now, this patient was a passenger in a vehicle. His vehicle was hit from behind, and they hit the vehicle ahead of them. That was a double impact. The airbags went off, and the patient hit his head. He went by ambulance to an emergency department where he had a CT scan, which is a type of imaging of his neck, and was discharged. He then went to his primary care provider. He was prescribed medication, no new imaging was ordered, and he was given PT. He went and took pain medication and did exercises for a few weeks, and he had no changes in his pain levels. The patient then found me and scheduled with me. When I evaluated him, he had neck pain that was constant, and it would be as high as 8 out of 10. Pain is rated on a scale from 0 to 10 out of 10. Now, no MRI was needed at that time, so chiropractic care was ordered. And after a month of care, the patient was better, but the pain was still too intense, too much of the time. This patient had abnormalities on X-ray that indicated that there might be a disc herniation underneath the surface, so an MRI was ordered. I reviewed the MRI and found a disc herniation at the C3-4 level, and the radiologist did not describe that. So I called the radiologist up to make sure that I had read it correctly, and we reviewed the images together. He agreed that the disc was herniated, and he updated the MRI report. With this updated MRI report, I updated the diagnosis, and we changed treatment. Within another 1 to 2 months, the neck pain from the disc herniation was down from an 8 out of 10 to a 1 to 4 out of 10. The patient continued to improve, and finally, 6 months later, we discharged this patient from treatment. All they had at that point was some residual neck tightness and stiffness once or twice a month. Had I not had the MRI, I could not have changed the treatment, and I'm really concerned that that patient would have continued to suffer. So what can we learn from this? The right MRI at the right time gives a more accurate diagnosis. A more accurate diagnosis gives better treatment options, leading to better results. So what can you learn from this? Well, I recommend that when choosing a chiropractor, you choose one that has advanced training and ability to interpret their own MRIs. This demonstrates a commitment to patient care, to patient safety, and to improved outcomes. Now, you have a lot of videos to pick from, and I'm honored that you chose this one to watch, and I hope that you learned something from it. You have many voices to pick from, and I truly wish you the best in your healthcare journey. So until the next time we meet, be blessed.